Hi YouTube. It's Monday the 10th of February, and I haven't been on YouTube. I haven't done a video for quite some time. My surgery was the 27th of September, so I'm a good 4.5 months post-surgery now. And I've been quite excited today because I had a follow-up appointment with my consultant orthodontist at the hospital. Um, and she's really happy with everything that's happened post surgery, and she mentioned today debonding my braces. So I was quite excited and thought I'd rush home from work this evening and put a video up online and just let everybody know. Yeah, so 4.5 months post surgery, nothing much has happened in the last 10 weeks or so, I would say. It all went quite quiet in terms of my recovery kind of petered out, and I began to chew my food and build up all the muscle again in my jaw, getting used to chewing. And I can pretty much eat anything now. I enjoyed my first piece of steak a couple of weeks ago, which was really nice. I have to be quite careful to cut it into small pieces so that I'm not giving myself really bad jaw ache. And if I have too big a meal, then I really do know about it because I get achiness in here. But yes, I'm pretty much eating everything that you put in front of me. Like today, I had a really nice ham salad baguette, really chunky baguette, and that was really nice. So I'm getting my mouth around most foods now, which is really good. I'm getting some clickiness in my jaw when I try and chew with my mouth closed. So I still haven't got enough range of movement to be able to chew my food with my mouth completely closed. So I am quite careful, for instance, if I'm eating in public, what I choose to eat so that I'm not chomping and slapping my chops with eating my food with my mouth wide open. So yes, so quite exciting news from the hospital today when I had my visit. My wires have been changed, and I think a slightly thinner wire has been put along the bottom, and there are just two teeth on the bottom that my orthodontist isn't particularly happy with. And the top has had a different wire put in again. The only thing that needs to change at the top now is my front tooth, this one. Sits a little bit higher than the one next to it, and there was a little bit of a gap. But within 5 minutes of putting the new wire in, she said, you know, this is going to be finished by your next visit, which is on the 25th of March, so 5 or 6 weeks away. And she said this is going to be finished by then because already you've only had it on 5 minutes and your tooth's moved into place pretty much already. So for the root to follow suit and for it to stay put, she said that she's quite happy that that will be done by my next visit. The bottom two teeth that still need a little bit of sorting out are that one there and the one next to it. That probably could take 2 more visits, she thinks. And then again, that's finished. That's as good as she's going to get them. They're not going to be 100%. When I bite together, you can see that here my teeth sit perfectly well, but this side there's a little gap, just a tiny gap here. That is just because on my top jaw I have a very slight cant where it tips, and during my surgery when they detached my top jaw they did try and level that cant out, but it's not completely level, so it does go up slightly. I try and put my head straight, slightly that side, but it's hardly noticeable. You might be able to notice as well while I'm talking that this side of my mouth isn't as the lip doesn't move as much as this side, and that's because I've still got a lot of numbness here. This part of my lip from say there to there is pretty numb, and this part of my chin here is pretty numb. But at the hospital they're calling it altered sensation, because although it's numb and if I catch my lip when I'm eating and I bite it, I can feel it and it hurts quite a lot. But the altered sensation is that when I rub my finger there, although to touch my skin it's numb, I can feel it on the inside like someone's tickling me with a feather. That is all perfectly normal apparently, and they're giving me 18 months for it to all come back. And if it hasn't come back after 18 months, probably that's what it's going to be like forever. But it's perfectly manageable. It's just, it's slightly noticeable when I'm speaking, but only to someone who knows to look for it. So just to recap, the exciting news from today is that not my next appointment on the 25th of March, but potentially the one after that on the 10th of April could be my debonding of my braces. Yay, get my braces off. I'm really excited because it was the anniversary last month, 4 years since my first consultation with the surgeon and orthodontist at Derby Royal Hospital. And that 4 years has just absolutely flown by. Now I'm here, but at the time it seemed like it was going slowly. But now I sit here and I'm post-surgery and I'm nearly at the end of the line with all my treatment. I can honestly say the 4 years has just flown by. It's been quite an easy journey. The staff at the hospital have made it so, I think, because they're just all wonderful. You build up a real rapport with them. So yeah, hopefully the next time I speak to you, it will be to show you my shiny teeth without the shininess of the metal on them. There's going to be a little bit of coordination needed on the day that I have my braces taken off, because these two teeth here, this one and this one, at the moment are temporary crowns, because I had porcelain veneers on those two teeth because they were set so far back in the good old days when I never even thought about having braces on my teeth in preparing for my wedding, which is 15 years ago this year. I had some porcelain veneers put on my teeth to bring them forward into line with the rest of my teeth. So those were taken off and temporary ones put on back in the teeth's original position so that my orthodontist could pull them forward in line with the rest using the braces. So when I have the braces off, the temporary crowns have got to come off and permanent ones have got to go on, and all that's got to be done within a very short turnaround so that I can have my retainers fitted. So that's going to require a little bit of coordination and flexibility on the part of me, my orthodontist and my dentist. So I've got that to try and sort out in the next couple of weeks, but it has been suggested that I ought to book an appointment to get that done on the 10th of April and at the latest the 2nd of June. So my summer holidays are booked for July, and hopefully this year when I go on summer holidays, I will be a big pearly white smile on the beach with no braces. Very excited. So I'll check back and let you know how I've got on after my next appointment. Any questions, anybody, please just email me and I'll be happy to get in touch. Thanks, YouTube. Bye.